Well, this is an ultrasound study of a 17 years old married female, and she had gone for induced abortion, case of induced abortion for unknown reasons. Now this is the uterus in longitudinal section, this area. This is the anterior, myometrium posterior. This is the cervix of the uterus. This is the urinary bladder, and here you see a breach at the anterior wall of the uterus, and from this breach we see a well demarcated thick wall cystic area protruding anteriorly adjacent to the lateral wall, right lateral wall of the urinary bladder, and there are multiple there are internal echoes are seen, and there are coarse echoes. So this well demarcated area extending from a breach at the anterior segment of the uterus, almost filled with different strength internal echoes, is a collection, possibly a bleed. And this area, this shiny area that you are seeing, is possibly a blood clot within the endometrial canal, because in itself this is the endometrial canal, and this collection measures approximately 4 by 3 centimeters, whereas uterus measures in longitudinal section 8.8 centimeter by 2.6 centimeter, which is anyway within normal dimensions. First baby went for induced abortion by an unqualified. Now you see this sharp, shiny area giving posterior shadow. This fine, sharp and shiny area is in fact RPOC, or a clot which gives faint posterior shadow. This is the cervix, anterior lip, posterior lip of the cervix, the vagina, the urinary bladder, the uterus, and the collection in longitudinal section. And within the endometrial canal, I have shown you a shiny area. This persists on longitudinal section. Now, this is the longitudinal section of the uterus, measures 3.7 centimeters, and there is a shiny linear area where in the center of the endometrial canal. This is the collection, this area, anterior to the uterus. Now these two cystic areas, this is the right ovary and this is the left ovary. I am performing this ultrasound with 3.5 megahertz transducer and curvilinear. And you see that this area, this is the ovary, this one, left ovary. Okay. To me, it seems to be extending into the subcutaneous area, and it's only the collection is only 28 mm deep to the skin. This is the skin in this region. This is the subcutaneous tissue. This is the collection, and this is the uterus. So this collection with internal echogenic areas as well is only 28 millimeter from the skin in the suprapubic region, extending in. So it's making a track. So it is making a track in the subcutaneous tissue. So extending from the uterus, this is the longitudinal section, this is the transverse section, and the approximate volume of this collection or bleed is approximately approximately 36 ml. The urinary bladder is intact, no abnormality seen relating to the urinary bladder, whereas we can see this shiny area within the center of the endometrial canal of the uterus. This is the uterus in longitudinal section. This is the collection. This is the collection. So this is the longitudinal section, and in transverse section the collection becomes longitudinal, and it is seen extending into the subcutaneous area in the region. So this is the uterus, this is the uterus in transverse section, this is the ovary, right ovary, this is the right ovary, this is the left ovary, this is the collection in transverse section. Which is only 22 mm deep to the skin, anterior to the uterus, that measures approximately 7.7 centimeter into 2.2 centimeter. This is the transverse section of this uterus, as well as this collection. Now what's happening is that the collection is extending, making a track into the subcutaneous tissue in the region. So this is the case of the day. Thank you very much. Now this is the